Before we get into the really, the numbers and stuff, you give us an update. Are you finding that there are people in your day-to-day life who are just, they are very harried and or worried or overly concerned about this? And what do you tell them?
I have found that. I've had a lot of people call me, a lot of people stop me, and what I try to tell everybody is, remember that the reason why this country is making such a big deal about isolating people and doing this self quarantine and doing all our social distancing is because we're trying to limit the numbers so we don't overwhelm our resources, and we're trying to protect those people who will get the most sick. That is not most of us.
Right.
Even if you were to get sick, Miss Robin, Miss Erin, you're probably not going to be terribly sick.
Okay.
You're going to have a pretty bad cold or maybe a mild flu, and then in a few days you're going to feel better. But we don't want you to get sick because we don't want you to get someone that you love that's perhaps at a higher risk sick.
Gotcha. There was a wild talk yesterday about a child in our area has tested positive for COVID-19. Can you clear that up? What do you know this morning?
So, no, we don't have any positive children as of yet. We do have some children that have been tested. Children are not the focus of our testing, of course, because we know that they are at least risk, which is, a blessing for this virus. With COVID-19, our children are not getting as sick as elderly adults, and so that's a blessing. But we don't have any children in our community that have tested positive. And let me clarify, a lot of people, I think, are confused in telling people that they have the virus. They're saying it on Facebook, they're saying it to their friends, and scaring a lot of people because they've been told to, quote-unquote, self-quarantine or self-isolate. That doesn't mean you have the virus. It means we're testing you for the virus, and we'd like you to stay home, especially we're asking everybody to not be out and about a whole lot, right? But we're asking these people to really stay home and to stay away from other people that might be at risk because we're not sure if they have it. We're testing them.
Any daycare's been impacted as a result of this?
As far as positive cases
or kids that were tested and kids were tested and maybe teachers were tested and they were told to, some of the folks that either work there or attended were told to isolate.
So we don't have any specific worries about a cluster of cases at any daycares. We don't worry about any teachers or other kids unless we have a positive somewhere. And then, of course, we have to make sure you have that close contact, which means what? Within 6 feet,
right?
30 minutes.
There's a reason
minimum of 30 minutes.
Yeah.
There's a reason I'm sitting 7.5 feet away from Erin right now. Her concern, her worry, her anxiety may jump down the table in my direction. Mm-hmm. Hey, Dr. Martha, we heard there was a rumor yesterday, and you can clear this one up too. About Erin, you tell her it was about Barksdale, but I don't remember exactly. What did I see?
Yeah, possible cases at Barksdale or a case at Barksdale, and they've declared a public health emergency on the base. What do you know about that?
So there have been some people tested at Barksdale, just like there have been people tested all over our communities, right? They're just like us. And the base I'm not sure if it's been official yet, but I think that they're looking at declaring a public health emergency. I don't know that they have done that as of this date.
Yeah, they have. They sent the email out yesterday.
Did they release that?
They did.
So they were looking to do that so that that gives their leadership a lot more ability to control movement on the base for their staff, for contract staff, for people who are in the military, people who are civilians on the base. It just gives them a lot more ability to restrict movement and to control the situation on the base. Their mission is vital for our defense, and so they want to keep their soldiers healthy. And it's very important that they really limit the spread of this virus on their base. They don't have any cases right now. They're closely monitoring with us. We're working close together. But that's why they did it, not because there are a bunch of cases there or there's anything to worry about. Really to give their leadership more flexibility in what they can and cannot do with their staff.
Okay, I'm a little bit miffed about this question, so I'm going to throw it at you. I saw today that Baton Rouge, New Orleans will be having drive-through testing. And yet no announcement yet about our area, though we've got at least 5 cases now. Is drive-through testing coming for Shreveport-Bossier?
So we've been working with our hospitals to look at what we could do in our area. What the hospital systems, we're looking, could we do one together? So the drive-thrus in New Orleans, let's be clear, those are they're federal stations. So the feds came in to help assist in New Orleans.
Okay.
They're also going to do some help in Baton Rouge. Baton Rouge, their community got together and set up one on their own, which is very commendable. That led us to talk to our hospitals. Hospitals up here are really looking to see whether they should do it collectively or whether they should do it on their own. There is some aid that's been done for their own physicians to make it easier. So if you go to your doc, I know, for example, Willis Knighton has, through their quick cares, they have, if you present at the door, they send you to one site to be tested. So there are some things that are being done to make it easier.
Mm-hmm.
But will we have something exactly like they have? I don't think so, but I think we're going to have easier ways to get tested in the near future.
Our cases yesterday afternoon were 196. You anticipate when the numbers this morning are released? Can you give us a sneak peek? What are we looking at? Over 200 now, huh?
Yeah, I think they're definitely going to keep going up. New Orleans is a city of close contacts, lots of areas where people like to gather, and that's one of the reasons why the governor pushed to close bars and casinos and really encourage restaurants, to encourage people to stay home and not gather. I think the more that we can encourage that, the sooner we're going to see these numbers stop climbing as fast.